Welcome to Pacer Nursing Power Hour, your go-to spot for real talk and real tips in the world of nursing.
So plug in, scrub up, and let's go. Because this is Pacer Nursing Power Hour, where students go to get powered up.
Today, we are talking about burnout.
Burnout, baby.
Burn, baby, burn.
Burn.
Burn,
Oh, I
baby,
was
burn.
going to say that song.
I
I was
got
like,
you.
stay
I
on
got you.
track, stay on track.
No. We don't
That's
ever
one of
do
my
that.
favorite songs.
So today, we're talking about burnout. It's very common in nursing. No matter what field you're in, whether you're in leadership, working critical care, ER, med surge, in an office, there's just so many pressures from all directions
Yep,
coming towards the nurse. So I feel like it's a lot to juggle as a nurse
it
sometimes.
is.
It's a lot. It's a lot of responsibility, a lot to juggle.
Especially when you're already having a bad day.
Yeah.
Yep.
So we've talked about this in the past. Remind me, what are the percentages of nurses reporting burnout?
I've seen statistics anywhere from like 43 to 53%, which is insane.
That is
That's a
that
lot.
is
I was like,
astronomical.
one out of every two nurse, they're burned out.
Yeah, that's
It's a
crazy.
little scary.
And
And what is burnout?
um
Well, that's going to be our next question.
okay, girl. She's like, let's get into it.
Got this.
So, burnout is different from stress.
Okay.
So, stress can be good or bad. Stress gets us going, gets us excited. Stress can be happiness, but it can also have negative effects. And burnout is that version of chronic stress.
Yes.
You are overdone with all of your task. You might have stuff going on at home.
Yep.
It's you're past being able to keep all the balloons in the air at the same time.
Yep.
And that's over an extended period of time.
Chronic stress.
Chronic stress.
Continued chronic stress leads to burnout.
Yeah. When
All kind of factors play into that too in the workplace.
and I feel like I would argue that the majority of nurses may go through short periods of time in their career where maybe they
Absolutely.
hit a wall and they have to mix up what they're doing or kind of pull away, maybe less hours or less commitments, whatnot. In your career, can you give an example of what that looked like for you? Have you ever hit a wall or felt burnt out?
Um, yeah, I had to take a step back from the ER
Mhm.
at one point. It got really I was having babies,
Mhm.
and we had 3 pediatric deaths, siblings that
Mm.
came in. Um, and I think that was the kinda tipping point for me. I'm like, I just need to take a break from, because you don't I mean, we've talked in the past, or maybe we're gonna talk about how as nurses, you kinda compensate for not letting your emotions get fully invested when you're at work. You kinda have a callus, you build a callus
Right.
to it. But there are times when oftentimes when you just can't circumvent that. You
Right.
can't circumvent those emotions.
It hits home.
So, it hit me hard that time when we had, stepping stone young children who died in a fire,
Mm.
because their uncle got, you know, smoked a lot of weed and
Mm.
dropped it, and it caught the trailer on fire.
Oh my
And then we
gosh.
had to treat the, father's burns because the parents were next door in another trailer playing cards.
Mhm.
And so, I guess when they realized the other trailer was on fire, we had to treat him with for lacerations because he was trying to break the glass getting in to save his babies. And so that kinda just did it for me right there.
Yeah. I think mine also occurred in the ER. At the time, I was working with the ER's sexual assault nursing program,
Mm,
and it was the hours invested into it, the getting called in and then not knowing when you're gonna go home, and the inconsistency
those
of my
things take
schedule.
hours, don't
Yes, yeah,
they?
one case takes about 4 hours, if
If
not
you do it
longer.
right,
Yeah,
and you
yeah.
have to do it right.
Yeah, and that's someone without a lot of injuries. I mean, that's someone that
Yeah.
doesn't have to get a CAT scan or doesn't have to get sutures or, whatever the situation. So on average, it's about 4 hours for a patient, but that stuff, it doesn't happen between 9 and 5.
Nope.
It
Nope.
happens any time of day, any day of the week. And at the time, my oldest was small and She had no clue. She is a ritual kinda kid,
Mhm.
and I could never say, "Oh, yeah, I'm gonna be home for work tonight," or, "Yeah, I'm gonna pick you up from
Oh,
school," and
yeah.
it was weighing on the whole family, which then weighed heavy on me
Mhm.
because my philosophy is family first always,
Absolutely.
and so that was when I realized, "Okay, I need to take a step back,
Mhm.
pivot," um, and that's when I applied to NP school.
Ah, that's a good break.
Ah,
The heck?
so
So that's the
silly.
greatest thing about nursing, though, is that you
Oh,
can pivot. And
always.
I think that we we talk about things that that are occurring in school and your career when you get there, or if you're there. We don't do enough to shine the light on certain aspects of the job. We know that we love it. We're all in this profession because we love it.
Mhm.
But that's one of the huge benefits of this career
Oh, for sure.
is that you can pivot and not skip a beat.
Right.
It does nothing but makes you a more marketable
Oh,
nurse.
absolutely.
So I mean, coping, just taking that out from talking about burnout, but that's the greatest thing about pivot in nursing.
Well, I think that's a huge part of this episode and what is important to you and I is that we celebrate all aspects of nursing.
Yes,
You and I are nursing lovers. I mean,
yes,
we are
nerds,
passionate about nursing
nursing
to our
nerds.
core.
Yep,
Yep. And we want to be honest
yep.
with this audience. I mean, not every day is shiny. There's gonna be some pits along the way and some road bumps in any
So
nurse's career.
what's I'm sorry.
Yeah, no.
What are some what when you started feeling the burnout, what were some of the
Oh,
what were kind of the feelings that led up to that?
number 1 is my sleep.
Mm,
I stopped sleeping well. I
yeah.
have trouble falling asleep. I wake up 1 o'clock, 2 o'clock, 3 o'clock, 4 o'clock, 5 o'clock, and I'm like,
Wow.
"Ugh."
See, that's just me on a normal night
Ah!
with some hot flashes. Um,
Ah.
that
What about you? What
uh,
are red flags for you?
I can't get out of bed.
You just feel
I
drained?
feel like I've been hit by a truck. Like
Yeah.
I know when I am mentally just drained. I'm
Mhm.
drained. I feel like I have the flu.
Mm,
I feel
that's miserable.
achy. So when I don't get out of bed for a day, it's like, okay, I need to rethink my priorities right now.
Mhm. Yeah.
And it's important to be, you've got to have that self-awareness. And I know I kind of roll my eyes out when I say that too, but because we've said before, it's all right now very touchy feely. Self efficacy is
Mhm.
huge in nursing, but it really is true. You've got to know your limits and you've got to know those warning signs
Mhm.
or your triggers, especially those
Absolutely.
triggers.
Absolutely.
And you know, so what are some flags or some warning signs that you may have seen that you didn't recognize that they were like,
Um,
stop, it's too much, kind of thing?
I think you and I are opposites. I'm a stress eater,
Oh yeah, I'm a
and
stress starver.
yeah, you're a stress starver.
Hmm.
That is something I notice. And then not balancing my time. I already told you, like, one of my first episodes of burnout was when I wasn't putting my family first,
Hmm.
and that was so stressful for me. And now that I know that and seeing that retrospectively, I will write little to-do lists, and I have Sunny, Stella, family, like
Oh, like you're to
yeah.
do for each member?
Well, yeah, and then I feel like, okay, I'm juggling this. I've learned Sunny and I, we have monthly mommy-daughter dates, and just small things like that where I feel connected to her, but then she also fills that time with me,
Yeah.
and then I feel like I can focus on work when I'm at work, and I can focus on family when I'm at family. And that was a huge lesson is penciling in family time. If
So
you don't pencil it in,
yeah,
it's
it's not gonna get
not
done.
gonna
And
happen.
so that's what's important also to, you and I have already talked about, how vastly different where we are in our career.
Mhm.
So you have young children, I have grown children with a grandchild who is my absolute dear favorite. Everyone knows him,
Mhm.
but, he's a little scary
Sorry.
right now. No, you're fine.
My long old
I
legs.
know, well, my short legs, I should be taking anybody. But, so, for me, I don't have a lot, like, I don't have to make sure because they're adults,
Mhm.
but I do anyway.
Right.
And it's hard, especially when everyone's going in opposite directions.
Oh,
So,
yeah.
yeah, that's another whole episode is family.
Yeah,
I think
seriously
we
though.
actually we have one scheduled around, Christmas break.
Well, for those who haven't experienced burnout in nursing, what do you think are some of the most common causes of burnout?
Well, I mean, everyone's feeling it right now, and that is, heavy workload balance at work.
Oh, for sure.
There's nothing more infuriating knowing you're coming in either at your max that have been told is your max because we don't mandate or dictate patient nurse ratios in this state,
Mhm.
where some states do. But then you maybe even be over that. And you know that every single time you come into work because there are not enough nurses
Mhm.
because 43 to 53% of them are burned out,
Mhm.
which that then leads to nursing turnover.
Yes.
So people are leaving. People are flat out going, I'm piecing out of the
Yeah.
career because of
Yeah.
stuff like that. And not just in addition to workload, like, it's not just one. There's a culmination of things that we have to deal with,
Right.
supplies, milk, not having milk for the patients in the on a pediatric floor. I mean, come on now.
Yeah.
So, yeah.
And I think we become fatigued in all aspects of life. Yes, there's long hours in nursing careers. So physically you're fatigued, but you're
Mhm.
also mentally fatigued.
Mhm.
I know we've talked about compassion fatigue and decision fatigue and noise fatigue.
Yes, auditory
I mean, there's all these things going on during your shift, and it's
yeah,
overwhelming. I mean,
golly.
so
How do
overwhelming.
we do it every day?
I mean, yeah, that's so true. But I like someone that's listening to this who's not in the field yet or is going into the field or early in their field. I want you to take what we've learned and start applying it now because then you won't be part of the statistic a year from now after you start your career. I mean, start penciling in family time and me time and quiet time. Like all this stuff
Yes,
that you need.
yes.
So look into yourself and analyze yourself, but then also look at nursing policies. Be a voice for our profession.
Absolutely, because we are the change.
Yes.
We are one of the largest professions in this country.
Yes.
And the fact that we don't often get a right to say what's happening. I know
Mhm.
this is very controversial, and I probably would be banned from every facility. But I mean, we need to be the voice. We need to make sure that you are practicing appropriately in your facility within your scope.
Oh yeah. Yeah,
And being safe. Oh my gosh,
yes.
having 9 patients on a med surge floor is not safe, and don't even get me started about working overtime.
Oh yeah. Um
And when they did mandatory overtime, do not get me started about that either.
Yeah,
Woo!
that can get my blood
I know, like, I'm already,
boiling.
like, going, I need to stretch it
Yeah.
out. I don't like,
So funny.
okay.
So
Again, but I love the profession.
yeah,
Because you can't
no.
not be there for the patient.
Well, and I think that is why nursing is partially a slippery slope.
It
You
is.
and I both get some excitement out of adrenaline.
Yeah.
Like you and I
Oh, yes,
thrive.
huge adrenaline junkie. That's why
We
I have
yeah.
so many things broken and over. I'm nosy. If there's
Well,
something going down, I'm gonna be in the middle of it.
and that is a double-edged sword.
Yep.
It can make us thrive in certain environments as nursing, but then we also go back to it and don't balance out, say, our mental health or whatnot. We're like, oh, yeah, we can handle an extra shift this week. Oh, yeah, we can do
Yeah,
that.
I
And
need money. Let me
I
work
mean,
5 in a
yeah,
row. No, no, no. First of all, you're gonna pay ridiculous amount in taxes. It's not gonna be
it's
as much.
not worth it.
It's not worth your sanity. However, I'm interested to see how this overtime that Trump's done, he's
Mhm.
cut back the
We'll see.
taxing. We'll see.
We'll see.
Because literally after, you work 40 hours, basically you're only making half
Oh,
of
yeah.
what you make
Yeah.
because it's taxed so heavily.
Mhm.
So I'm interested in seeing. So whoever's doing that, whoever's
Yeah.
working in overtime, let me know. Let us know if this new tax law or whatever is making a
Made a
difference.
difference.
Yeah.
And I think the same applies to students
Yes. Oh
with
my gosh,
with
yes.
burnout. I mean, we see students before they even get into their career drop out of programs because of the academic overload. You have to learn a lot. You're balancing clinicals and curriculum
And family
and
and
family,
life.
everything. It
Yes,
is a lot. So,
absolutely.
and this applies to students just as much as anyone already in the career. So I'm super excited to ask you in particular this question.
Oh gosh, me?
Mhm.
Ruh-roh. That's never a good thing.
Well, you
No
and
one asks
I
me questions unless I've done something wrong.
so you and um, we have very different perspectives on I don't
Y
know the right way to say this. We just have different views of mental health and
I'm
how we
pharmaceut
juggle.
I'm pharmaceutical, you're essential oils.
Yes. Yeah, we have very different outlooks on wellness and mental well-being. So I'm curious, have you ever asked for help?
Like a formal
Yeah.
I mean, I've only gone to therapy once in my
Mhm.
life, and after that,
You're done.
no.
You're not going
I don't
back.
like to revisit my feelings. You remember,
Okay.
again, it's the
I
we
know, that's why I think it's a generational thing.
it is because we were taught to suck it
Sweep it
up
under the
and
rug.
just move on, and in fact, I was just we were in a meeting just now, and I was sitting next to a psychology major, and we were talking, I asked her what she wanted to do and stuff, and she said she wanted to be a counselor. I'm like, "Oh, thank gosh, we need more of those in the world. Yes, yes, yes." And, she said, "Yeah, we don't talk about it enough." I'm like, "I know, however, I just put mine on the front porch." I mean, I am okay with saying I'm having a schizophrenic day, and it is okay for me, or a bipolar day,
Yeah.
but I'm not either of those
Well,
yet.
I lean the other direction. I intermittently will go to counseling. I went during my BSN program here at
Well,
USC
I
again.
mean, come on, Katie, you had a ton going on
I
during
did.
that.
I did get knocked up a month after starting the
Yes, you did.
program.
Way to go, Daniel.
Thanks.
Woohoo!
Thanks, babes. So I had Sunny halfway
We
through the
love you,
program.
Sonny.
Had Sunny halfway through the program, and postpartum depression is no joke. So
Oh.
that hit hard while I was in the nursing
Wait,
program.
who was that actor who said Brooke Shields did not she was ridiculous because she had postpartum depression?
Are you serious? I haven't heard this.
Oh, yeah. I'm gonna have to Google that.
Okay,
Yeah,
let me know.
there is a huge might even been Tom Cruise, but yeah, Brooke Shields is kinda one of the first ones I remember talking about.
Coming out about it,
Mhm,
yeah.
and she got,
It's
like,
serious.
shamed.
We don't talk enough about it. We don't talk about depression in general enough, let
Mm-mm.
alone postpartum depression.
Love me some Wellbutrin.
I love it. Pharmaceuticals.
Right here.
But yeah, even throughout my nursing career, when after I went to court for one of my sexual assault cases, it was a very vivid case. I mean, you don't go to court until like 3 years
No.
after you
I've done it
actually
twice, don't ever wanna do it again.
yeah, so you get called to court about 3 years or more after your
Yes. That's
um
why you have to document, document, document. Sorry. I just had to throw that in there.
Yes, you have to document,
It was the
document,
same
document.
case that I use as, like, reason for why
Yes.
you're having to document so
Yes.
much. I talk about being in the box, and
Yeah.
it was horrible, horrible, one of the worst moments of my career.
Yeah. So I, get called to court. It's been 3 years since I've done this case, and I was
That
trembling.
was so
It
scary,
was
so
so scary.
intimidating.
So and I had anxiety. I mean, I had to look this perpetrator in the face the whole
That's the
time.
worst part,
And you have to say your
and looking
full
at the victim.
name. It was just so overwhelming. And I went to counseling during that period.
Did
There's
it help?
oh yeah. Absolutely. You have to have a good facility, like a good relationship with your
Therapist?
therapist or psychologist or whoever. Yeah, and
So
And now I've been to not good
Okay.
experiences where I'm like, "Yeah, this is pointless." I've had one who knew I was a nurse and wanted to ramble scientific jargon off to me for an hour, and I'm like, "No, that mm-mm.
What?
I know what you're saying. I don't know, it's not doing it for me." So I stopped going. But then when you find that one person, um, it can change your life. Yeah, it can change your total
Well,
perspective.
that's awesome.
Yeah.
Kudos.
Yeah. So very thankful for people that do that. Um, yeah,
So,
so
if
yes,
for
I
those
have asked for help.
okay, so I think the only time that I have done this, which is my Wellbutrin comment. Um, you know, I go see my I've always chosen physicians very carefully. I'm
Mhm.
very, I have a pattern and truly believe in female and or especially mid-levels. But over the years, I just will actually say during my annual I'm anxious. Don't I feel like everything is, an impending doom. And so, that started my journey of the SSRIs.
Yeah.
And then, finally after I don't know, after raising kids, being divorced, being single, 4 hours away, working 3 jobs and then coming back home. I remember going to my doctor who I have seen all of these years, who is now retired, and it just breaks my heart. I miss her so much. But she was one of those, and I have to have the right physician, just like you
Yeah.
say, therapist, because I don't want so many times you get discounted for your feelings, and I've seen this more and more and more. We're not allowed to own our
Mhm.
feelings, and that's so not cool. And so when I would say, I'm so anxious, and my 80-year-old dad was just diagnosed with leukemia, and I'm trying to, and she's like, well, how about let's put you on some Wellbutrin, and then and we got it to a cocktail. I call it my cocktail, and it's been there for 7 years. So I say I don't really ask for help, but I believe that's kind of a what's the word?
That's how you asked for help.
Yeah,
Yeah.
I guess. I don't I c and again, pharmaceuticals,
Yeah.
not essential
Yeah.
oils, because there's something that I cannot get through that, and probably I need to go to therapy to work through that. I don't know.
I'll keep working on you.
I don't
I'll
know.
talk about it enough that you'll
Yeah,
you'll
yeah.
try it again.
I mean, that's what friends are for too, though. Really good friends,
That's what
But
I'm
y'all will
here
meet my
for.
my BFF coming up for Halloween, and you'll see why she's my
Mm.
BFF.
Yep.
Love her.
So there are lots and lots and lots of resources
Oh, yes.
for students, current nurses, anyone out there. We've already talked about some of them. Maybe you need to have a discussion with your provider
Yep.
and be started on something if life is overwhelming, if it's too much. And just to throw it out there, these do not have to be permanent fixes.
No, no,
Just,
no. You don't have to stay on them for life.
yeah, just like I said, I go intermittently to counseling. I go for a series of weeks and then I put all the puzzle pieces together in my brain and I'm like, okay, I got
Work through
this.
whatever's
Yeah.
happening. Mhm.
And then we move on. And there's a period of life where I don't go for years. Counseling may not be an everyday tool. However, there are apps now where you can text a
I've
therapist
seen
all
that.
day, every
How
day.
much is
I don't
that?
know, but I've never done it. But maybe that's how you'll get connected. I
I
don't know.
know.
We'll see. But there's mindfulness apps like
Oh
Headspace
gosh.
and Insight.
I have tried those. I have tried those. I know everyone. I'm like, there was a point in my life where I felt like I needed to change me,
Mhm,
my person,
mhm.
like who I identify
Yeah, yeah, yeah.
as. And I wanted to be more non essentials.
Mhm.
And so I did try all of that. And then laying there at night instead of taking my Ambien, my half an Ambien, not taking it and I'm listening to that now. Close your eyes. Listen to the sounds of the forest. I have too much talking going on.
Yeah,
I can't hear her because my mind
yeah.
cannot get blank. And I just heard something today again. I love going to so many different things that are not just nursing. When I heard stress is good.
Yes.
That was an interesting perspective because
Yes.
I always say I am never not stressed out in my life. Never. There is always something going on. And when I heard her say that today, eventually I just said, that's just life. But when I heard her say that today, I was like, it is good. It does. It makes us do what we need to do. It helps us survive.
Mhm.
Maybe I don't live this massive stressful life. Maybe I accept that it's life
Yeah.
and it's good.
So we went to the same class today.
Yeah, it was
We
fun.
just finished a 3-hour class, and
And I know.
the thing I took away from that same little snippet was that I'm not stressed, whatever work, school, trying to get Blackboard set up is stressing me out. I'm not I'm
Yeah.
not
The
stressed. It's
tasks are your stressor.
yes, the what you need to identify what is stressful, and then that allows you to
Take it off of
overcome
you.
yes, overcome it and cross it off the list as opposed to just saying, I'm stressed, I'm overwhelmed. So I think that's a beautiful thing to take.
That is a great way to think about it too. You're not stress. Like I don't know if I've mentioned before. I used to have a physician that called me a poodle on crack
Mm,
because I would just run around.
mm,
But sometimes I do feel like that because there's so much happening,
yes.
and I blame it on me not being able to cope better with
Yeah,
it. But then, a as you say this, uh, that's a great perspective to have, that it's not my internal wiring,
right.
it's the stress of doing the
Yes.
tasks.
And I think that is critical in this episode talking about burnout. And we as nurses can apply that mentality before we get burnout. Let's assess what the stressors are and let's do something
Yeah, and
about them.
identifying those warning
Yes.
signs. I think
Yes.
that was a really good
Mhm.
takeaway as well, is understanding your warning
Mhm.
signs and then doing something before you get to that over the what you call
Yeah.
tipping point.
Tipping point.
Yeah, which
Other
I felt that deeply,
yeah.
very deeply.
Other things you can do on a daily basis is just take a pause.
You're gonna say meditate, aren't you?
No, I'm not going to say, well,
Oh
I
my
might say it
gosh.
eventually, but I'm just saying take a pause. So if you've had a super chaotic day and it's one of those days where I'm trying to think something other than a bad word. Hold on. One of those days where, never mind. You're having a really bad day.
The perfect storm of a day.
Yes, thank you. I was like, I kept coming up with bad words. So if you're having one of those days where it's just a perfect storm, you have all crazy critical cases, take a moment. You can ask your work wife, whomever, to say, hey, I need 3 minutes.
Yep.
Go to the bathroom, step off the unit, go outside, get some sunshine in your eyeballs, hide in the storage room, whatever, for 3 minutes, take a deep breath. And that's something you can do consistently every single day to calm down and
You know,
readjust
if
yourself.
you think about it, did you ever work with yeah, you're probably very young, but early in my career, most everyone we worked with were smokers.
Oh, yeah. So, yeah, go take a smoke.
Smoke break.
Yeah.
And I'm thinking to myself, I wonder how often I'm sure they were out there smoking, but that was their
Where they're
way
just,
of they didn't necessarily need the nicotine, they needed the moment.
yeah. And
So,
I think that is
I'm not
huge.
I am not a proponent of smoking, people, do not take that away. Alright, so pause
So,
or time
pausing.
out, put yourself in timeout.
Yes, put yourself in timeout. I like that. Other things you can do on a daily basis is set healthy boundaries for yourself. Know yourself well enough to say, no, I can't pick up this shift.
That is what I struggle
Yes.
with every day, saying that one two-letter word I cannot say. In fact, I told you today, I've said yes to so much stuff. I don't even know when school starts how I'm gonna manage to do my assignments.
I have a funny story for you.
Okay. I love funny stories.
So
Much better
while we
energy
were
than
in
that.
our class with my TA sitting next to me, we started talking about her next semester and whatnot, and she's in my women's health course, and I was like, "Well, what do you wanna do?" We're just chit-chatting. And she was like, "I'm not gonna lie, women's health is not my jam." I said, "It was not my jam in school either. I could not stand it." And I told her a story. I said, one of our last recordings for the podcast, we were talking about women's health and labor and delivery and birthing. And when I was editing, I realized Kennedy beat around the bush and would never say the word vagina.
No, I don't.
Ever. And she was like, "Oh, yeah, that's me. I could never say it." So now you're up to 2 words. You are incapable of saying vagina, and you're incapable of saying no.
I hate that word. I hate that word. I hate that word with a passion. You're right. I will not say that.
When I was editing, I was like, "Oh my gosh, she's never gonna say it, is she?" I kept, like, waiting, and I was like, "She's telling the longest story ever just to avoid saying vagina."
Nope. Nope. Was it the
Yeah,
mirrors?
I don't remember.
Oh
I
my
don't
God,
remember what
no.
the actual story was because I was so distracted by not saying vagina.
Yep.
Okay, here we go.
Where were we? Oh, healthy boundaries. How
Yes,
to
how
say no gracefully.
yes, and additionally, plan your week.
So
Sit down
that's
on Sundays or whatever day and plan out your week. Know when you're going to work. Plan in sleeping. We
yes.
talked about this today also.
Yeah, and I think we
Plan in
talked
sleep.
about, planning my me time.
Yes, plan in your me time.
Mhm.
Plan in when you're gonna prep your meals, cook your meals. Write it all out so you can see it and see where you're having deficits. If you're only getting 4 or 5 hours of sleep,
There's a problem.
I'm looking to my left.
I can't. Oh, yeah, that was me last night, not gonna lie.
If you're not getting good sleep, then you need to make adjustments. But yeah, quick self-care ideas that you can actually fit into a nurse's lifestyle are
I've
huge.
got one for you. When I need to just get it together,
Mhm.
I would go up and down the stairs.
Yes, I
It
loved going up
I
and
mean,
down
it
the
was only
stairs.
5 flights.
Yeah, it's not bad.
Obviously, back then, I was much better at it than I am today. Yeah, so I would literally just go run up and down, like, because we've talked about those endorphins,
Mhm.
and I'm not as good about exercising as I should be and as I used to be, but endorphins are an amazing drug in themselves.
Absolutely,
Yeah,
absolutely.
and I agree with the plan. You've got a
You
plan.
have to.
We've already discussed the commitment and the time for this program,
Yeah.
and then when you get out, you suddenly feel like you have all this time, but then we've also discussed after you work 3 12 hours, you're
Mhm.
physically
You're
exhausted, so
physically,
how
mentally
you gonna do
exhausted.
that?
Yeah, you have to juggle it.
Yep, yep.
I'm not good at journaling, but I know some people thrive on journaling. It's not my jam. So if it is, that is a great everyday task that you can do to help keep yourself in check.
I
It's
do
just
it
not
when
my
I am
jam.
at, like, peak points.
So I mean like your version of counseling.
Yes.
Yeah.
I
You're your
just
own therapist.
yeah, just and it's so interesting for me to go back
Go.
and read it after I come out of whatever that hole.
That's cool.
Yeah, so
I
I do
like
and
that.
I do go back and read them.
Good. You'll have to teach me how to journal. I'm just terrible at it.
Oh, I just brain dump emotions. It's literally what I do. I
Hmm.
don't hold anything back, just brain dump.
I'll have to try it sometime. I've
Mhm.
never thought I was good at it.
Who grades it? So
I mean,
who's giving you a
myself.
qualitative rating on your
Oh.
journaling?
Mm. So those are all things you can do consistently, multiple times a day, every day.
Yep,
But then there's also long-term habits you can create, whether this is your jam.
it's my jam. That's why I'm
Setting,
in my doctoral program.
yeah, so you're a huge advocate for finding a mentor
Oh, yeah,
and setting up a mentorship for
absolutely.
each
You gotta
individual.
have someone that's not in your unit
Yes.
for you to feel safe enough to say you've built up that relationship enough to say, is this process legit? Like, should I be doing it this way? Things like that. We want you to question things that you know,
Mhm.
and you need to have someone that you feel safe discussing
Yes.
having these conversations with, and having a mentorship kind of has so many connotations to it. It's like, here, let me shape and form you to be like me. No, that's not it.
Mm-mm.
It is peer support, having someone available that you can reach out to and say, how do I work through this?
Yes, absolutely. I I think that is something I missed out on as a new grad and still currently. I've gone through periods of my career where I lean onto certain individuals and they're like my sounding board,
Mhm.
but there hasn't been anyone consistently over my entire career where I'm
Mhm.
like, okay, I'm getting stressed at the ER. Should I make a leap of faith and go to the MP school? Like I'm spastic kind of about it. And I was actually talking to my overseeing provider yesterday about this, and I've gotten to a point where I'm a little frustrated with healthcare. And I feel like if I had that long-term mentor, I could use them as that sounding board. And where can I use this frustration as an outlet to make change?
Okay, so I'm gonna challenge you with that
Okay.
idea of thought.
Okay.
So, again, this is where mentorship, again, brings that
Mm-hmm.
connotation of shaping and forming,
Mm-hmm.
but in reality, it's peer support.
Yes.
So, I'm gonna say
Okay.
you've had that your entire career because you have peers that you're very close with
I mean, that's
that are
true.
nurses that are your sounding board,
I mean, true.
and that's how you navigate the profession with, I think.
Yeah.
But
I can get behind that.
a formal structured program, yes, absolutely. It is so in need that I'm doing my project on it because
Yes.
it is the literature or the evidence is there that
Mm-hmm.
we've got to further support our new grad nurses,
Yes.
specifically in that second year of practice.
I love it.
But so for you, yes, absolutely. I just Again, that goes back to my generation too, but I still am very impassioned because now I can see what happens on the other end. I can see the
Mm-hmm.
students in the new grad perspective, which I think is what drew me to wanting to do a mentorship
Mm-hmm.
program, which is more peer support.
Yeah.
That's a common thread in any evidence or
I like
literature
that.
article. That is the theme. Is It's a lack of peer support, a lack of a supportive culture within that organization. I feel like as nurses, we talk about it.
Yeah. Well, in any job, you generally have a preceptorship,
Yes.
and that is very different than a
Yep.
mentorship. So, and I think that might be part of the problem is you have to have a preceptorship to know like the
But
codes to the rooms
yes,
and
they
how
just
the unit functions and things like that.
yeah.
But this is more of a I have concerns or I have questions where you're not going to get shot down or written off about them. It's your kind of like
Or
your
it won't
other
go back to
brain,
your
you know?
manager or whatever.
Yeah,
Yeah,
yeah.
for
You
fear
don't
of that. Yeah.
yeah.
And it's helping you navigate that culture. Again, that culture in that
Mhm.
organization, helping you navigate any issues that
Sure.
and it's let's just face it. No one's gonna reach out because I mean they could. I would love it if they would reach out. Oh my God, I had a great and sometimes they do, but most often when you're reaching out it's because of something not positive.
Right.
I'm
Right.
trying to be optimistic
Well,
here.
even in this world of academia, students never reach out to their professors. I mean, they
Mm-mm.
just don't. Even though day one, I say 1,000 times, I'm here for you. I'm here for you. I'm here for you. Here's my email. Here's my office hours. But if
Here's my
those
cell
don't
phone.
work, yeah, if those hours don't work, just let me know and we'll figure something else out. And like I'm available, and no one ever comes to you. You
I know,
know?
and I feel like they don't really feel like we're real.
Yeah, like real people.
Yeah, but
Yeah.
no, our that offer is real.
Mhm. Yeah,
It
no, I mean it.
it
I
is
mean it.
come to our
Yeah.
office or just email me.
Mhm.
I mean, I've started collecting the names of the people who are coming through
Mhm.
orientation that are nursing. So I sent out one mass email. I've had several students reach out already
That's
asking me
awesome.
questions.
That is awesome. Well, I think that's the beauty of a mentorship. I was talking to a student today and she was like, "Yeah, I've heard about this in this class or I've heard about this in that class and these are the hardest topics in this class." And I think that's the beauty of having relationships with nurses or other students that have gone before you to
Which you
kind of
can
pave the way.
copy paste that into your professional life.
Mhm. Absolutely.
Having someone outside helping you get through you know,
Yes.
learning until you get more, not more seasoned,
Yeah, comfortable.
comfortable
Comfortable.
in your, practice, yeah,
Yeah, for sure.
absolutely. It's hard. You feel like you're an imposter for a year or so too.
Yeah, that first year is interesting.
Like, "Why did
It's
they
a
let me have a license?
that is
I
so
wasn't
true.
ready. I don't remember this drug."
And then I did it again with my NP license.
Yeah,
I'm like,
I did
"Wow,
it when I started this job.
they trust me a lot." Oh, I still feel very uncomfortable on a daily
You
basis.
shouldn't.
Well, thank you, thank you. So other long-term habits, we talked about mentorship. We talked about scheduling and
Non-nurse
scheduling
time.
in that
A
non-nurse
good
time.
facial can keep me going for
Ooh,
a month.
yes,
And
girl.
now,
And it looks amazing.
I
Your
know.
skin looks so good.
Um,
Other long-term habits are consistent movement of your body.
yeah.
There's so much science behind this. It's
You
redonkulous.
know how bad it is, when you've been sitting in a chair for so long? And again, we talked today, our classes are 3 hours long.
3 hours.
Now we do give you breaks if, you know, for those professors that actually remember.
Mhm.
I, however, am not one because I get so excited about whatever
Mhm.
I'm talking about. But yeah, you gotta get up and move.
Get up and move. A healthy diet.
Yeah,
You
that
have to fuel your body for 12-hour shifts. You should not go 12 hours without eating, despite whether you get a
lunch or not.
paid lunch break or whatever. Even, I mean, you have to put in your little nurse bag high protein snacks, well-rounded snacks. Don't just have chips
Yeah,
and
I can't I
candy
can't
and
preach about that
caffeine. I know, I know.
because
I'm doing better though.
yeah, I'm not good at that. This is one of those, hear us and please do it. Just don't judge us if we don't.
One of my summer goals was increasing my protein intake, so I'm consistently getting over 100 grams a day. And it
100?
mhm, and
Holy
it
cow.
totally falls on snacks. Like throughout the day when I'm working a 12-hour shift at urgent care, I have to have high protein snacks to keep going. I mean, there are literally times where you don't take your eyes off of what you're doing, so you have to,
Wow.
like, grab and
No,
go.
I'm a starver, stress starver,
Yeah.
so I just don't eat.
Yeah, I
I
feel
don't know
you.
why. That's why I have gained so much weight since I started working here.
Oh my gosh. So, tools for students in
Yes.
particular include balancing the clinical and classroom load. It can be difficult depending especially on what level you are in your program and how comfortable you are with documentation and
Yeah.
how your clinical is set up. In our program, some classes you pre-plan, and that can be just grabbing your patient, or that can be spending a couple hours pre-planning
Yeah.
and really understanding your
And
patient
also,
before you roll in.
it's the drive to get there because the facility might be
Yes.
a little bit distance away. So you really have to plan because
Mhm.
if it's going to take you 30 minutes there and 30 minutes to get back, you're going to be there, depending again on the course and the
Yes.
level of information you have to have. You could be there for 1 to 2 hours.
This semester, I am going to drill that from the first second the
How do
semester
you
starts.
pre-plan for OB?
You don't.
Yeah, I was about to say.
You don't. We roll in. I mean, you have no idea. There's no way I could post patients. They're all going to be gone by the next day.
Exactly.
So you don't pre-plan, but I will drill this home from day one for my students. This semester, we have mixed up our schedules. So students are doing clinicals at the beginning of the week.
I'm curious. I can't wait to see how this is going to work.
I
I'm
know.
so excited about that.
So I actually have a Tuesday clinical group and we go till 9 p.m. and the next morning they have med surge. And I feel a little guilty about this and guys, I did the
Wait,
best
what
I
time
could
do
to
you
schedule
start?
1 p.m. So those students cannot stay up late studying the night before. They just can't. They're not going to get home
Oh,
before 9:30
so,
p.m. And then you consider I've been in scrubs, I might have some amniotic fluid on me. Like
okay.
you just like you're going to want to shower. So we're talking like 10 or 11 p.m. you actually sit down to study. So it's just not going to be feasible. So those students are going to have to plan ahead. You have
Yes,
to break up your studying. You have to look ahead like 2 or 3 weeks and say, "Oh gosh, I have a med surge test. Let me get going."
absolutely.
So again, study harder. St-
Study
study
smarter.
smarter, not harder.
Yep. Don't waste your time on stuff you already know. And we've
Yes. Oh my
already
gosh.
talked about having to how to figure that out.
Yes. If you haven't listened already, go back to test taking strategies and balancing student workloads. It's just
It
critical and it will flow into your career, and once you've mastered it as a student, it will just be seamless as a
Yes,
nurse.
absolutely.
No
Especially
one's
because so many of our students wanna go back for advanced practice.
Yes.
Everyone no one wants to be at the bedside anymore, except if you're an NP. You wanna be an MP at the
Yeah.
bedside.
Yeah. Other things you can do is be okay with not being perfect.
Yeah, that's really hard again, I can't s
It's so hard, and I think a stereotypical nurse thrives off of perfectionism, like,
yeah.
that's their goal is
Lines
being perfect.
labeled,
Yes.
patients clean,
Mhm.
meds given, doctors happy.
Yep, we're used to checking off everything on our task list,
Mhm.
so we're just kinda wired like that, but there's times where perfect isn't always the goal, and being okay with that.
Yeah, that's hard to accept sometimes.
And I view it as I'm learning constantly, still every single day, I'm learning
You
something
should be
new.
learning even me
Yes.
in the career like today, I mean, I can't even begin to tell you how many things I've learned today. The day you don't wanna start learning or you don't learn
Mhm.
is, again, the day you need to find another job. Go
Absolutely.
work in a flower shop or something.
Uh, Example, yesterday, I worked with my overseeing provider, and there was something that I saw on a patient, and I was 99% sure I knew what it was, but I'd never personally diagnosed it before. I'd just seen it in textbooks, read it, seen pictures, whatever. So I popped out and I was like, "Yeah, I'm not 100% sure." So I'm announcing I'm not perfect in front of a whole staff. Like, "Can you pop in this room with me and look at this and just
I
reassure me?"
love that.
And so I nursing, you always have to be able
Well,
to
so many of us, like, even as a nurse for 30 years, with when Professor Wilson and I worked on peds, I would like, Come here and double check this with
Yes.
me all the time."
Yes.
You don't have to know every
You
single
don't.
thing. You just know how to find it
Mhm.
and resource
Huge.
it.
And I think that is goes straight into our next point, is that leaning on your support system, your work wives, your director, your overseeing provider. Don't act like you know everything, because that's when you make a mistake.
Absolutely, don't get cocky.
If you're a student, lean into your professor, lean into your cohort or the people who have gone before you, like we just talked about.
Absolutely.
Ask them, how are you successful? And that's why we've done this series we have this semester of students that have already overcome your level and giving tips and tricks and pointers of how they were successful in that.
Yes, that's gonna be I'm excited for those.
Mhm.
Okay, and
The last one's so
I
fun.
know. So I love this because I just created in a course that I'm just temporarily teaching online. Um, we're talking about creating a preventative burnout
Mhm.
toolkit. So it immediately brought to mind one of the assignments our students, we really focus on the courses focused on chronic conditions and
Mhm.
complex care, continuity of care, all that kind of stuff. And so one of the assignments that I have is that they have to create an action plan for their chronic patient.
Yes, patient with chronic
Like
conditions.
if you go to the CDC, the asthma prevention
Mhm.
toolkit. That is a perfect example of okay, so my symptoms are here, I'm in the green, my symptoms are here, I'm in the yellow, and then what to do for each
Yes.
level. And they just had to turn it in, so I'm getting ready to grade it. So I'm uber excited. So, yes, in order to prepare this prevention kit, definitely need to know your warning
Yes.
signs.
Warning signs, triggers,
Yep.
and then what works for you to get you back on track.
Yes.
So
So, everything
you
we've
can
just
map
talked
this
about.
out. You
Yeah.
can map it out and say, okay, I'm in the green when I am sleeping good and eating good and working out 3 times a week. And I feel like I have my study schedule down. I'm in the yellow when I'm having trouble falling asleep and I'm just eating junk food because it's exam week. And you need to regroup, take a minute and
Like, I
regroup and
was
get
in
back in
the
the green.
I was in the yellow at one point this summer because I had a perfect storm week,
Yeah.
and you missed midnight 2, not 1, 2 midnight deadlines.
Mm.
And that put me in the yellow zone. So I said, "Mary, get it together."
Yep.
And I took 2 hours and put every assignment into my calendar electronically.
Yeah.
Um, and at that point, I kept totally up.
Know thyself.
Yep, know thyself. Absolutely.
So we would love to now
Yeah.
discuss some topics that people have sent to us. So, someone asked, what is our go to coping tools when you feel overwhelmed? We've kind of touched on it, but I think your example that you just said was mapping it out,
Yeah.
every little tidbit.
Well, I mean, I'm not gonna lie, my first thought was, "I'm gonna have a glass of wine and
Yeah.
sit down and think about it," or just complain about it for a second.
Maybe that's why it took 2 hours.
Yeah,
And for some people, that is a coping mechanism.
but not a healthy one. I'm not,
Yeah.
and I'm not telling everyone to
Not
have
saying that that's the thing that everybody should turn
and I
to.
said a glass, not a bottle.
True, true. My
What's your go-to?
cleaning my house.
Okay, I'm gonna stress you out and bring you over to my house.
No, my house stresses me enough. Well, that is one of my warning signs. And I actually talked about
A
this.
messy house?
N- well, when I see my messy house, when it bothers me and I like can't do anything else until my house is clean.
And, I told you today I feel like I'm overwhelmed today.
Mhm.
It's because my kitchen's not cleaned.
See, mine's a little bit different. Like when I feel like my plates aren't balancing all the plates that I juggle, then my house feels messy to me. When yesterday, if I had my plates juggled and my house looked exactly the same, it wouldn't bother me.
Oh, see, no.
So that is a
Again,
warning
it's the
sign for me.
perspective that we talked about
Yes.
earlier. Stress is good.
Yes, stress is good,
And
and it
then how did you perceive what was your perception of what she said? You said something else, a different viewpoint.
hold on. Hold on.
Oh, it's not myself
Oh,
being
yes.
stressed. It's the tasks that are
It's my
stressed.
to-do list that's
Yes.
too long,
That
so I
your
need to hunker
internal
down.
wiring is perfect,
Mhm.
if you have to say that.
Mhm.
It's this all the things.
Mhm.
And
It's everything else.
and sometimes it's not a choice of whether you can say yes or no.
Yeah. I will say I am not the greatest at equally dividing my time. I get hyper focused on a certain area of my life and I have to check myself frequently to say, "Ooh, I worked 2 12-hour shifts this week. I need to edit, but my family does come first, so let me regroup. It's okay if this podcast sits a couple more days
Absolutely.
unedited so that I can spend time with my family."
And don't answer my text
Nah,
messages.
never, never. I'll always
No,
answer.
no, 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 don't. I mean, I tried so hard not to text you last night.
No, it's all good. And then I started blowing you up.
This morning?
No, last night I was sending you videos all
No, I
night.
know. But no, when I got your text that said, I can't deal with this. I'm cooking dinner and I'm
Oh, yeah,
eating
that
with
was a
my
couple
family."
nights ago. That was a
I was
couple
like,
nights ago.
"Okay,
I need a minute.
yeah, she needs a
Yeah,
minute."
yeah.
Yeah.
So, in summary,
Yeah.
have to know your warnings, have to know your triggers. So, know thyself, and then start early to prevent the burnout.
Yep.
Start recognizing those and do an action to prevent that stress from becoming burnout. Don't make it chronic. Deal with it.
Ask for help.
Ask for help. You internally are not the problem. There's just a lot going on in this career, in this life of yours.
Mhm.
So step up to the plate
I'm gonna
and
just interrupt because it's also important because this is very applicable to this very moment. The student I was sitting next to today, um, we were talking because I had made the comment, I'm curious to see, because I don't think any nursing students have been a TA before. So I'm curious to see how this is going to affect or impact their load. And this student, who is not a nursing student, said, "Yeah, I have heard how insanely intense nursing is. I mean, it's reputable apparently.
oh yeah.
So it's even more important that you understand and can identify all of this take away the 3 things, any 3 things, because we've said a lot of good stuff
Yeah.
today. I really do feel. It's not been super funny,
Yeah.
but it's important,
It is.
and I want everyone to understand that it's okay. Stress is good, remember? But just know what you need to do to prevent not being burned out.
And I also think if you're a student or even if you're a nurse, you have to give yourself credit. You have to understand that others are looking at you and they say, wow, I don't see how you do that because this program is rigorous. It's hard. Other
Mhm.
students are in awe of what you as a student can do, and other careers are in awe of what you can do as a nurse, the knowledge you have, the strength, the mental stability you have to take care of others. So give yourself credit for that.
Yeah, show yourself some grace too.
Yes.
Love
Yes.
thyself. All right.
Next week, our dean.
We have a huge event coming up next week too.
Yes, it's a big week next week.
Oh yeah, huge.
But next week in the podcast, in the studio, we are bringing in Dean,
Dr. C.
Dean Dr. Katie Shargaloff, better known as Dr. C.
Because
And
no one knows how to say it or spell it.
true. And she's going to tell us why this program is the best program in the state, in the nation.
It is.
Why you should come.
It is.
So join us next week.
Yep. And she will answer those comments. I am so excited. In case you don't know what events happening next week, we have a new pathway for admission. So we're having an open house on September 23rd from 5:30 to 7 here at the nursing LMB Miller Nursing Building. Do you know how many times I've written that in the last 2 days?
I probably don't want to know. So as always, follow us on all the social media accounts, Instagram, YouTube, Apple Podcasts, Spotify. And if you have questions for our dean, please send them to our Instagram or email me, and I will be sure to ask her. Thanks for scrubbing in with us.
Thanks for scrubbing in.